questions, so we're making sure we're hitting all the high notes.
Yes, and Catherine is our host, so she will do all the prompting and welcome you all to the show. So as usual, just talk to us about your experience. I think we're going live now, so I have to.
Sensitive messages, bit better than WhatsApp. Dip and chat. Free messaging to digital customers. 10-way voice calls non-stop. Messaging of the thing like watch your chat disappear on the spot. Activate the digital prime bundle to get free data to pip non-stop.
Every day is Christmas when you switch to Bip. This Christmas you can win with Bip. A Merry Christmas. Spin and win with Bip. This Christmas you can win with
Santa
Bip.
bip bag full of electronics, handsets, holy for cash to win once a bip. Bip and bip and bip and bip. Spin to win all kind of prizes, yeah. Start living, get bipping. Cause Bip is a vibe.
Download Bip today.
Champion House is back to normal opening hours and is better than ever. Open Monday through Saturday, 7 a.m. to 10 p.m. and Sunday, 7 a.m. to 5 p.m. Now offering our full dine-in menu as well as our delicious dishes by way of the island's best breakfast and lunch buffet. We now also offer outdoor takeout on Fridays and Saturdays. Remember, we're here for all your indoor and outdoor catering needs throughout the Christmas holidays. Call us today at 916-5736 for more info or stop by for that familiar good cooking taste. Champion House, where locals dine.
The views expressed and the opinions given by the individual hosts and their guests do not necessarily reflect those of Star 927, its affiliates, or sponsors. Live from the 927 studios in the center of Payments Capital, Georgetown. This is Straight Talk. Let's get to the point.
And good afternoon and welcome to Straight Talk. This is your Drive at 5 show, and I am your host, Catherine Tyson. I want to welcome you to the show this afternoon, this beautiful Monday, 5 o'clock. Wow, where did the day go? And where did the weekend go? Welcome to Monday. And of course, today is Medical Mondays and is brought to you by Health City. So we are joined in the studio with some of the good folks from Health City. Miss Tiffany Dixon Ebanks, who is the Global Sales and Marketing Manager, has come through this afternoon to help us host the show that's brought to you by Health City on Medical Mondays. So good afternoon, Tiffany, and welcome.
Good afternoon, Catherine. Thank you once again on behalf of Health City Cayman Islands for having us in the studio with you. We are always happy to be here. And as Global Sales and Marketing Manager, I just want to say to your listening audience who were looking out for Shomari Scott this afternoon, I'm filling in for him. He wasn't able to make it this evening, but I'm sure you'll hear him soon on this station talking about the great things that Health City is doing in our community locally and internationally. Prior to COVID, there are a number of cases, in terms of visiting patients who have come through the Cayman Islands and have benefited in health-wise in terms of surgeries and various treatments from or vast or a variety of different specialists that we have at our facility. And we are very fortunate this afternoon to have on our show one of those patients. So I know you kind of had a little background in terms of, their benefits, and we have them with us this afternoon, streaming in live, the Molloy family. And I'm not going to take the thunder away from them because we want them to basically give the Cayman Islands listening audience, a little taste of their experience at Health City Cayman Islands. So sometimes, we just need to take a back seat. We work there and we promote and we are always talking about what we do, but we also like to listen to what the patients, the feedback that we get on an ongoing basis. And that's one of the things, doctors thrive. And anyone providing a service and, putting their heart into, life-saving services, surgeries, and so on. It's always good to hear from the patient's perspective down the road when they are actually doing well. months, years after surgery. So, Catherine, I'll ask you to invite them in.
Yeah, absolutely. I mean, I at the end of the day, right? You do what you do for the patients. So if there were no patients, then all your fancy stuff that you do there and fancy equipment wouldn't be of any use. So really, at the heart and soul of it will be the patient. So it today is just kind of rounding off the year during this Christmas season, just talking to the people that you serve and that have how you've impacted their lives. And as every Monday, you guys come on and we talk about the great things that's happening at Health City. And it's a medical Monday, so it's awesome to hear all of that good stuff. But today we actually have, like you said, an actual patient and the family of the patient to actually talk to us this afternoon. So I want to go ahead and welcome Kristen Rivard and her husband Christopher Molloy and their entire family. That's street. So if you're on Facebook, you can actually see the Molloy family. So welcome and good afternoon.
Well, thank you, Catherine. Thanks very much.
Thank you, Catherine.
Thank you.
Absolutely. So yeah, why don't you give us a little bit of your background and talk to us a little bit about just the impact that Health City has had on your lives?
Sure. Well, Catherine, we kind of happened along Health Cities, like not expecting to. We were on a family vacation on a cruise ship when I became very ill out of the blue, actually. And luckily for us, the cruise ship's next port of call was Grand Cayman. And I was very fortunate in that I was able to be taken off the ship and receive medical care at Health City. And that's how we kind of came upon it, sort of accidentally, but very glad that we did.
Absolutely. Yeah. Because, I mean, obviously, when we're going on vacation, we're not thinking of anything like that. We're thinking we've been waiting for this amount of time and we're just excited to be out. Now we're going to have a great time. And then obviously something happens. So, yeah, that would definitely be a situation, to find yourself in. And so you were able to be treated through Health City. So your entire family, at that point, then your vacation must have stopped.
Yeah, we were on a Disney cruise, and I think from my understanding, they are very, very careful about where they let off patients that need medical care. So we actually could have got off the ship earlier. I think they held Kristen to arrive in Grand Cayman because of Health City's reputation. And the way it went down, I think, it was, hours into the cruise, Kristen came down with something, I thought she was maybe seasick. And then 3 days into the cruise, we get a knock on the door and they say, "Hey, listen, you have to pack. You need to leave the ship." And I was like, "Oh, wow. What do you mean leave the ship?" They're like, "You've got to leave the ship." Kristen was gravely ill. It was like an absolute nightmare. Very, very precious seconds to get ready. My daughter at the time was 6 years old. And the most important thing in our mind was what's going on with mom. And the first thing we noticed is just the beautifulness of the island. We had never been there before. So even Kristen in the hospital gurney getting loaded into the tender, what was one of the first memories you had?
Yeah, it was interesting. I was like, "Oh, the water is so blue." I was like, not out of it, but I remembered the water and I was like, "Oh, But yeah, it was, we were very, very fortunate to be able to, be taken to Health City for care.
So how long did you have to stay?
We were I was in the hospital for about 18 days. So, it was quite a recovery, and being so far away from home. We're from Boston area in Massachusetts in the United States. So it's a long way to be away from home. So we decided, and my husband with under the care of Dr. Deepak, who will always hold a special spot in my heart. I was able to get all of my care as much as I could in order to get myself back to the United States. I was able to kind of convalesce in your facility at Health City in order to get healthy enough to travel back to the United States. So it was a long road, but definitely one worth traveling to get back to where I am today.
And she was in ICE. So you were in ICU for what, 8 days?
I think it was like 8 days in ICU. And then, the rest of my time spent in a regular, hospital setting just to try to get my strength up. And then I spent another week on the island until I was ready to, get under my own power to get back on an airplane to get home. So,
Right.
And it was kind of interesting. So when we've never been on the island. We knew Health City. When someone said, we're going to take you to Health City, I had no idea what that was. And Kristen's mother is a nurse, and she's a nurse in one of the top hospitals, not only in Boston, but one of the top hospitals in the United States. And the minute we arrived, I knew it was serious. It was going to be touch and go, life or death situation, which Kristen, if you know my wife, she never gets a cold. This woman is never sick. She does everything. No one can function without her. So I'm in a complete state of panic. I have her mother texting me nonstop, get her back home, get her into Miami, get her off the island. What is Health City? Because being Americans, sadly, some of us can be a little ignorant, right? I mean, I'm guilty of it myself. So when I started researching Health City, the first thing that came up is the Forbes magazine article. Yeah. And then you start reading about Dr. Shetty and the work he's doing. Now, the phone continuously is ringing to have her get off the island. Now, luckily, we're very blessed, and we're very, very privileged, okay? We work for great companies, great health insurance. The money isn't a factor here. So after a while, when she started recovering a little bit in ICU, the insurance companies were like, hey, Catherine, Tiffany, we want to fly her out now. We'll fly her out. It's totally on our nickel. We want to get her into Miami ASAP. Right. They are all over me because they're very concerned about potential liability. So one of the things I said to Dr. Deepak is, and he probably will never forget it, and there's not a better doctor that I've ever met. Okay? So we're in the ICU unit, and they're talking about flying us home, and I shook his hand, and I wouldn't let go of it. Now, my wife's sitting in the hospital bed looking at me saying, what is this nut doing? And I won't let go of his hand. And I looked at him and I said, finish the job.
Yeah.
We don't want to go to Miami. As I said to the insurance company, why would you want to fly me to Miami on your nickel when I'm getting the best care possible? I don't know, Catherine, if you've ever been in the ICU unit, but you could eat breakfast on the floor of this facility. And
it's said that on the floor. Yeah.
And it's not just the doctors, okay? There's no doubt they're best in class. But the minute you walk into Health City, there's something really special going on. Remember, I know no one on the island. No one, never stepped foot there. The minute I walked in, I was surrounded by people. So you're talking custodial people, staff, the cafeteria manager who actually said, they knew immediately we weren't the normal patient. Yeah. So I have a 6-year-old who the cafeteria manager is giving a free cookie to. Right. In my mind, that cookie's worth $1 million for what it did for my daughter.
Yeah.
So if we're talking to a family that had a choice that we easily could Metaflac her out, no cost to us, into Miami, into an American hospital, we chose to stay there. Mm-hmm. There, in our minds, Health City saved my wife's life, but it's hard to put into words. There's a special feeling in that facility. Yeah. And tell them about the rounds. The story you told me about the rounds, the doctor rounds.
Oh yeah, I just I would wait every day. I knew just to get myself better, I would just wait for them to come in the morning, and then they'd come in the late evenings. And it would just be, that was my motivation. I'm I was going to get out of there, but, they would come every evening and, always put a smile on my face and made me realize, all right, I can make it to the next day. So, just that caring and going out of their way, it was very special. And
the number of staff. Right?
Yeah. And just the total number of people who were there to care for me. So
here's a kind of a funny story, but when we're in ICU, this just tells you the reputation of Health City. A patient next to Kristen, who was a doctor from another country, had flown himself into Health City and brought his own medical bag, okay? So he's in an ICU bed with his own medical bag. He's a very intelligent man. And I listened and I watched the doctors negotiate with him to say, hey, please, doctor, let us take care of you.
Yeah.
Let us take over your care.
Down your bag.
Yeah, it's true.
But with the reputation of a doctor flying himself in, he could fly anywhere in the world probably for healthcare.
Right.
And he chose to go to Health City.
Yeah,
That must have been some reassurance for you as well.
definitely was.
Yeah. No, definitely. And I know I lived in the U.S. like half my life, so as you were talking, I realized right away that any American would say, "Get back to the States, get back to the States."
Right.
Yeah.
But in actuality, if you were getting care here, it might have been more risky to move you to a totally new facility, whether it's Miami and who knows, it could be the best on the books. But the fact that you're getting top care to be moved might have compromised your care at that point. So it
Yep.
was the better decision to stay. And we're just so happy really for you to have joined the show today to really tell this story, because it's the truth, and to hear it from someone who might have had a question, oh my goodness, am I in the right hands, to
Mhm.
actually say, yeah, actually I was. And what I'm also hearing too, Tiffany,
Yes.
this is very familiar to you because of your past job, right? Is the Cayman kind.
Yes.
Yeah.
Yes.
So
Definitely.
and for years you were the DOT director, right? So
Yeah, I was the executive director of the Cayman Islands Tourism Association before I joined Health City.
Yeah.
So the whole Cayman kind and hospitality, and the way of life, and what we like to promote as a destination, is that welcoming, and it's really, for me, I'm in awe sitting here. As I said, I'm filling in for Shomari today. I never met the Molloy family before. And so I'm really on air with you right now as we're talking to the members of the public. I'm talking to this family for the first time.
yeah.
And so hearing this from Christopher and Kristen in terms of their experience, it kind of draws everything back home to me in
Mhm.
terms of why we all at Health City, we kind of buy into the ethos of service.
Mhm.
So it's, a medical condition is a medical condition, but at the end of the day, we're looking at successful results, but also doing so, getting to that point in a compassionate way as well, which is it's the vision of Dr. Devi Shetty, who actually
Mhm.
started the NH hospitals in India. That entire ethos was taken and dropped in the Cayman Islands.
Mhm.
I'm not too sure if the Malloys, if your family has seen the recent Netflix video. There's a video series that just came out within the last couple of days. It's called The Surgeon's Cut. And they featured, I think it was 4 or 5 different physicians. Dr. Shetty is in the fourth of the series. And you know, if you have some time later on this week, if you haven't yet seen it, go on and watch it. It's about a 45-minute.
Mhm.
It's kind of like a docu series, but the way they did it was really nice. Just kind of looking at it kind of went into a little bit of his personal life, why he started doing what he was
Mhm.
doing. And near the beginning of the video, which I watched it recently as well, I wrote it down before I came here today because I wanted to share it. It said, one of the quotes that Dr. Devi, he said something to the effect, every surgeon is like an artist, and the aim is to come out at the end with something beautiful.
Well
You
said.
coming on here today
Mhm.
to share with us the outcome of something beautiful just kind of brings it 360 degrees to fruition that, Dr. Deepak, at that point in time, he was the artist over
Yes.
your body, right? To get you to the point where you could be, you have your treatment, you're healed, but then years later, you're able to then be living a healthy life, be able to share with us what your experience was. And so you bringing that here and talking to us today, it kind of is, telling someone else who is a current patient, this is something that they have the opportunity to look forward to years down the line and say, this is the result of the treatment that was received. And just for the listening audience as well, who might not know who Dr. Deepak is, because you keep saying his name, Dr. Deepak is our senior consulting gastroenterologist at Health City. So everything internal, he deals with a wide variety of issues on an ongoing basis. And, the other day as well, I know the show isn't about that, but the other day I had the privilege of organizing a CME, which is a continuing medical education event for doctors in the Cayman Islands. And Dr. Deepak and Dr. Sunil, who are both or gastroenterologists at Health City, they were able to provide an educational moment for all doctors in the Cayman Islands, not just those at Health City, but there many doctors came out to kind of hear firsthand from him, on procedures and tips and tricks of the trades in the medical field. And so we're proud of the fact that he is also able to impart knowledge to others. And having someone like him on our team is excellent.
Yeah, we've had him on the show a couple times, even since I've been here. And so the listeners would be very familiar with Dr. Deepak because we've really talked to him in depth a few times, even with Shomari. So it is really good to hear actual living, moving beings speak about all the things that the medical personnel or the personnel from Health City talk about, but to actually hear people say, yes, this is actually what happened. So we're so happy that you were able to join us this afternoon for that. I hope that you will consider the Cayman Islands a second home and not that wasn't a one-off thing, because it's not that far away when you really look at it.
No, we'll be back. Definitely. COVID kind of stopped us from coming back again, but we will be as soon as we can return to your wonderful island, because I do have a lot of fond memories of it too. It's the whole family. We're looking forward to come back and visit because your kindness was just over the top, I think, at a very difficult time in our lives. So we really appreciate that and look forward to coming back and enjoying it in some happier times.
We're glad that you had that experience. I have one question. When you went back to the States then, so obviously you would have your follow-up or your U.S. Medical continuation. What did the medical personnel say to you? What did your doctor say in terms of your care?
Tell her about Western.
Well, it's interesting. I did need to have some further care when I got home. And, we're blessed to live near Boston, which is a major medical hub. So I ended up at Mass General Hospital, which is one of the best hospitals, second best in the country for us. And, I think when I first came in with, they were like kind of looking at me like, you were where? Like for how long? What hospital? And, I went in there. My husband made me be prepared with my big file of everything you sent me home with. And, they read the doctors, the infectious disease and, my attendant.
The head of the infectious disease department.
They read through the files and they were like in awe. Like they couldn't believe A, the care I got, B, what was wrong with me, and that I was still there, like talking to them, telling them like what else I needed to have done for follow-up. And, they were just so complimentary, like beyond, and they educated themselves about it because they really didn't have knowledge outside of this country, the different types of medical and what Dr. Shetty is doing. So, they were just very, like, I think all of the way they work there, it's like you have a whole team of doctors. They just couldn't wait to read my records because I was fascinating to them. Not only that I was alive and functioning, but the care that I had received and, the diagnosis and the surgery that had got me, well again. So, it was a great experience, and they were just so complimentary and just blown away, I think, by my care.
The first question they all had, the number one question, Kristen, what was it like being operated in the Caribbean?
Yeah.
And you could see in their eyes this fear of, it must have been just terrible.
Right.
And we're looking at it like, you're not supposed to have a great time at a hospital, but looking back on it, it was just I hate to use the term wonderful experience, but it's just such a different experience, Catherine. And I want to clarify one thing. we didn't want to go back to Miami because we were afraid to move her. If that was the right thing to do, if I believed in my heart that she was going to get better care in Miami or at Mass General, no problem, because there's nothing we wouldn't do to take care of Mom. But I knew in my heart, I knew with Dr. Deepak, Dr. Patel, who was the lady doctor? She was unbelievable.
Dr. Arachetti, I can't pronounce her name. She's a pulmonologist that you guys have at Health City, Tiffany. I think it's
Dr. Archita?
Archita. Yeah, she's fabulous too. She
and she's also our chief. So she's a pulmonologist, but she's also our chief of infection control.
Yeah.
So anything, and I always kind of tell this story because when I started at Health City, being on the non-medical side, because I'm in the background, marketing and administration, so I'm not really dealing directly with patients. But every employee, once you start working at Health City, they go through the whole training on how to wash your hands, how to do this, how to make sure, because you're still in the building, right?
Right.
Whatever it is, no matter if you're not dealing with patients on a consistent basis, you're still there and you're still representing Health City. So she is very meticulous on her role as the chief of infection control. And this was before COVID. So it wasn't, COVID just kind of heightened this for members of the general public, but for those in the medical profession and certainly those who work with Health City Cayman Islands, she makes sure on an ongoing basis that anyone coming to be employed, they know the rules. These are the guidelines. This is how you wash your hands. This is the 7 steps of hand washing and so on, and what to look out for. So yes, I understand what you say when she made sure that you were okay.
Yeah.
Yeah.
I also find that just when I can compare the U.S. to here, I find that there is a lot more. I don't know. It's not necessarily hands-on, but it's a little more creative ways of doing things as opposed to very pharmaceutical. Like money. Like this gonna cost this. It's gonna cost that, and it's so. I find America does that a lot, which I find that it really is a very personal thing. You almost feel like these people are your friends. These people care about what's going to happen to you. You're not just a patient. You're not just a body,
Yeah.
And I think that when you are in a situation that you're already scared, you don't know what's going to happen, that gives you so much reassurance. It really is something that can help lead you to recovery easier because your mind is at ease. And so you feel like I'm in good hands. These people actually care about me. They're coming in, they're talking to me. I have access to them. And I find when there's a larger hospital, although there's, state of the art this and all of the rest of it, it's still not that personal care. So I think that is where Health City and your experience in the Cayman Islands versus being in the States at that particular time, that's where the difference could have been. So,
well, we talk about it a lot. I think Dr. Shetty was very shrewd in the location that he picked because it is the Caymanian people, the Caymanian culture. It's real. You feel it. The Cayman kind. I could tell you story after story after story of people. I'm totally on my own here. I'm facing a life and death situation. I mean, listen, I'm worried I'm going to put myself in the bed right next to her, okay? That's how worried I am. This is someone I love and care for more than anything. This is a serious matter. That Caymanian culture. I'm not a resident of the island. I'm a visitor. But it's a feeling. You feel it. You can taste it. The people around me. When I was walking by myself around the hospital grounds, the people that would come over to me. So I would say to you, Health City is great. The doctors are fabulous, but it's the surround sound, right? Yes. Tell the story about the custodian woman every morning, what she would do.
Yeah, I mean, just even, the nursing staff was fabulous, but I had a lady and she used to clean the ICU, and every morning she'd be like, "It's okay, honey, you can do it. You can do it." Just little things like that she made such an, impact on me that I was, it's just from one end to the other. It was just very, compassionate care.
That doesn't happen anyplace else. And it doesn't happen with many other cultures. I think, in my humble opinion, placing that hospital on Grand Cayman with that culture and with the sister islands, if you will. When Kristen finally got out, we were interacting slowly with a few people on the island, and people would see her struggling getting in and out of the car and come running over to help. I mean, I get very passionate about it because you can have the greatest staff in the world. And you know this, Catherine, you're a host in a radio station. You could be the best host in the world, but if the surrounding staff is unpleasant to deal with or not professional or don't have empathy, there wasn't anyone in Health City. I mean, we want to go back to Grand Cayman just to visit the Don Hospital. Like, who does that?
It's a great hospital. It's the truth. Even to stop in for lunch, trust me, it's awesome.
Oh, we know a lot about the lunch.
Right, for sure. We're going to take a quick break, but we'll be back with more. So you guys just hang on there, and we'll come back and continue talking with the Molloy family. If you're listening to us, this is Straight Talk Drive at 5, Medical Mondays, brought to you by Health City. We're talking to an actual family that's giving testimony of their experience at Health City. Also joined with me in the studio is Tiffany Dixon Ebanks, who's the global sales and marketing manager this afternoon. So just stay tuned. We'll be back with more.
Join the conversation. The phone lines are now open. 943-3700. More Straight Talk to come on Star 927.
Kirk Freeport's Black Friday weekend sale is bigger than ever, with up to 70% off an incredible selection of watches, jewelry, and accessories. Even better, Kirk Freeport is giving extended access to the sale all day Thursday through Monday. Find the sale at Bayshore Mall and Cardinal Avenue, or enjoy late night shopping at the Strand until 9 p.m. Get unbeatable discounts from brands including Roberto Coin, Swarovski, Bulgari, Masica, Doves, Ippolita, Lagos, Fossil, and many more. Plus, take an additional 10% off all non-branded sale merchandise. It's Black Friday all weekend at Kirk Freeport. Visit kirkfreeport.com for full details.
Burger King Sawyer, the perfect burger is ready.
Very well. Tell me.
It's a quarter pounder with melted cheese and mayo. You see, the simplicity is what makes...
Add another patty.
Another? But Sawyer, that will make it a half pounder.
Add bacon.
Bacon?
Crispy onions.
Burger King has gone wild and brought back the Steakhouse King. 2 quarter-pound flame grilled beef patties, thick-cut bacon, A1 thick and hearty sauce, crispy onions, melted cheese, and mayo. Only $7.50 or $10.35 for the combo, and only at Burger King for a limited time.
Christmas miracles do come true. Renegade, Execution Rentals, and Event Pro presents Enchanted.
Baby, when the bright lights start to fade, fire.
Saturday, December 26th at Coral Beach. Music by Selector Renegade, Joshy Vibes, DJ Craig, and DJ Diesel. Come get enchanted as we transform Coral Beach. Cabanas, VIP, and ball service will be available. Tickets are now on eventpro.ky. Come get enchanted Saturday, December 26th at Coral Beach.
Man style different, step up on them.
Imagine you had one wish, a wish that builds courage, creates hope, inspires change. Rubus Pure Joy Wish Fuel Thinking has arrived. Win weekly cash prizes, and 6 people will win $5,000 in cash as a Pure Joy Wish. Every time you fuel up with $25 or more at any Rubus service station, it's a win. Win for you and these 5 great charities. Feed Our Future Cayman, Alex Panton Foundation, Humane Society, Big Brothers Big Sisters, and the Cayman Islands Cancer Society. Rubus Pure Joy Wish Fuel Thinking ends December 20th. Terms and conditions apply. Rubus, fuel the difference.
Welcome back to Straight Talk on Star 927.
And welcome back to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host, and you are listening to Medical Mondays, brought to you by Health City. Every Monday, the Health City people come in and talk to us about this amazing hospital that's in East End. And today, no different. We're talking with Tiffany Dixon Ebanks, who's the global sales and marketing manager. And we're also joined via live stream by the Molloy family. And they're basically, if you were listening the first half hour, talking about their experience with just, it's Kristen and her experience just having to come off of a cruise ship and a vacation, no doubt Disney cruise. So the entire family now just, is in a situation that they did not expect and ended up at Health City. And the rest was history, I guess they say, huh?
Yeah,
for sure. So yeah, definitely Cayman kind at its finest, I would say. And I'm so proud to say that, right?
Yes,
Yes.
definitely. We're just very happy. I am happy. I think if anyone was listening earlier, as I said, this is the first that I'm talking with the Molloy family, with Kristen and Christopher, and just hearing the enthusiasm that they have used to describe their experience with Health City. Not only having the service and the treatment that they need to get better, but the little add-ons which made that healing process
Yeah.
that much better for them. That is just awesome to hear. And I know that everybody at the hospital right now is working, or people are either getting off of their shifts and in their cars going home, and maybe there's some people listening. But if there's anybody at Health City listening this afternoon who isn't with a patient right now, I just want to say hats off to you, the medical team, the nurses, the technicians, everyone that's there, who are, going above and beyond on a daily basis. There's a lot of things in medicine and hospital care that the regular John public, you go, you're ill, you want to get fixed, and you want to get fixed now. Right? But it's a very challenging environment to be in. It takes strength, it takes grit, and it takes a lot of dedication. And so I just want to just say hats off to the medical team at Health City. And then there are those of us in the background that are supporting all of that: marketing team, the admin team, the financial services team. They're all, the insurance, ensuring that, all the ducks are in a row in terms of covering your costs and so on.
That's right.
It's a lot that goes into it. So just want to, take my hats off to everyone there, tell them thanks, and listen to the Molloy family telling you how you have, help them on their journey of recovery. It's something that's good to listen to this evening, just for me personally, but
Right.
I just hope that, there are other staff out there listening too.
Yeah, absolutely. And I talk about the
Executive health check.
that you guys have.
Yes.
And I had gotten this done a few months ago. A friend had told me about it.
Yes.
And I've been telling all my friends about it. And I say that from checking in at the reception desk until I left,
Mhm.
everything was amazing. Like literally your staff was finding me all over the place. And then I traveled with a group of women, because it was all of us that were kind of doing it
Together.
We didn't even know. We just met that day.
Oh,
And we
okay.
met in the cafeteria together, because they provide you with breakfast and lunch. It was an amazing, amazing experience. So I can just imagine, and then comparing it to, somewhere else that does not have that kind of hands-on or
Right.
bedside manner or whatever, So definitely. But before the break, we were talking about the cafeteria, and I have to tell you this. If you didn't know, like Mr. Molloy was saying about choosing the Cayman Islands for the location was just a genius, right?
Mhm.
But the restaurant there is associated with Blue Cilantro. Is it still associated with Blue Cilantro?
Yes, it
And Blue
is. Same
Cilantro
chefs.
is one of our top restaurants, and
That's
my daughter and his daughter were in school together, so I know him very well even before he opened this restaurant. It is one of the top restaurants in the Cayman Islands, which is crazy. So that's what's at Health City, is what I'm trying to say. So there's nothing other than amazing things going on at Health City. So
Oh yeah,
that's
and a couple of other things that I think you touched on too was just, as we were coming in, we were picked up by Chris and Michelle, the ambulance drivers. And my first interaction with the hospital was Haywood. Now we're unique.
Yes.
Okay, we're unique. I'm a complete mess. Okay, I am completely lost. He takes all my paperwork. He takes the time to go through everything. He looks at me and says, "You're all set." And then he starts explaining to me my choices of things, because I don't know what to do, right? It's Kristen's being taken care of. I've got a 6-year-old with me, right? So what do we do? Where do we go? He went out of his way to make sure if I used, what was the hotel? It's Canadian owned, by the way. It was just, it's right down the street. I'm sorry.
Is that the Wyndham Reef?
That's right, the Wyndham. So
Yeah.
I spent the first night at the Wyndham, and I remember saying to Haywood, "Hey, we're going to go to the Wyndham." He's like, "You make sure you get the Health City discount." So, I mean, just walking me through like a baby, the steps to take, right? It was just unbelievable. And when you talk Cayman kind, okay, so I immediately reached out to the American embassy there, not embassy, the American consulate. And I think I spoke to Dana, who is married to a Caymanian. Okay, she's American. And she talked to the hotel, or it may have been Dr. Lockwood's wife. I get confused. It's been a little bit. Because I started immediately reaching out to business contacts I had. And they set up a day for us and my daughter at the hotel. They treated her like a princess.
Of course.
Gave her a chance to get a break while I could get back to the hospital. And you just wrap this all up. So listen, don't take me wrong, Catherine or Tiffany. If American insurance is kind of bizarre, I'm really trying to get Shomari to say, start thinking about servicing things the American insurance companies won't cover, because you'll go right down there to have any procedure done. You talk about the executive checkup. We were supposed to go to the Grand Cayman about a year ago, and then COVID hit. I had signed up for that. Now, I can have that done here in America, but I wanted to go to Health City to have it done again.
Amazing.
Just to have another set of eyes on it. And when we talk about, and not to talk about money, but healthcare is expensive. But I don't like to talk about the cost. I like to talk about the value. So just to put in perspective, we were in the number 2 hospital in the U.S., Mass General, for about a week. Those 7 days, none of them were in ICU. We spent 4 times the longer at Health City. So we were at Health City 4 times longer and almost half the time in ICU. And we paid a third of the cost.
At Health City.
At Health City. So I'll say this again. We were at Health City 4 times longer, half the stay in ICU, and the cost is a third less.
Exactly.
And I would argue this. The care was better.
And then you were in a beautiful Caribbean island.
You know, the island's beautiful, but there's many beautiful things that if they're not properly presented, the island would be nothing without the people.
The people are what make the island beautiful.
That's right. We have traveled for work quite frequently. The difference with Grand Cayman is, and I know you're probably saying this guy's completely crazy, right? Put yourself in my situation. When you're lost and there's people around you who you don't know.
Right.
Yes.
Who embrace you. They don't have to do that. And they know what's going on with my wife. And here's something really unusual. Speak of that cafeteria. And may I recommend the chicken stir fry?
I've had that. Yeah.
On any of the Indian dishes. But I would go in there, and now I'm used to going into a doctor in the U.S., right? And if you were to see the doctor outside your official appointment, you kind of like stay away from them.
Right.
When you walked in the cafeteria in Health City, and there's Dr. Deepak, there's Dr. Patel, there's all the nurses, they're coming over to you.
Exactly.
They're coming over to you like I'm trained in the U.S. like, well, I better not say anything to them. They're like I'm a movie star walking and waving to me hello. And it's such a different feeling.
Yes. And if you asked them a question, they'd answer it. So
and without a bill, Catherine, without giving you a bill. Okay.
It's a very different experience. It really is. Yeah. Definitely.
And it's up and down the ladder too. I mean, I unfortunately I can't remember everyone's name, but they had a young man, Dwight, who worked at the front, and I think he was like a greeter.
Yes.
When I talk about a classy young man.
Oh, I'll have to go back and tell him that.
I love that guy. I think he was studying or he was going to school for AC.
Yes, and right now, I just want to let you know, you'd be happy to know that he is doing the AC technician training right now. He's now, he's with the maintenance engineering team now that he was studying. So he came in at a different position in Health City and he was channeled through. We actually have our Healthcare Explorers program, and there's part of that looks into, staff that wants to train in other areas. So he's actually on his way now. So you'd be happy to know that.
Aw, that's good
I
to
mean,
hear.
when you talk about a classy young man,
Yeah.
okay, and then you talk about not only the care the hospital is giving people, but we follow the hospital. I mean, we follow it with an interest. And you speak about healthcare explorers. Then there's the commitment not only to the patients, but what about to the island?
Yeah.
And how you're trying to uplift and provide opportunities for people. I mean, that's a pretty novel thing, right? It should maybe just be all about patient care. Health City is much, much more than patient care. In fact, I'm rifling off names and experiences I've had. What was this, almost 2 years ago?
Yeah, it'll be 2 years in May.
2 years in May, and I'm talking about Dwight
Yeah, we remember him.
as much as I am Dr. Deepak.
Yeah.
So what does that say about the brand, the culture, the energy you feel? I mean, you can't hide from it. Honest to God, if I was facing a serious surgery, right at the top of my mind would be Health City. I mean, it's just, I can go on and on, but I just hope it doesn't get lost in the conversation. The people that make up Health City go from all different rungs on the ladder, right? It's everybody. The security guards. They used to talk to Kristen as she was walking herself in the aisle, making her feel comfortable, encouraging her. You can't, there's no amount of money in the world that pays for that type of relationship.
Yeah, absolutely. Money can't buy that for sure.
No.
Wow, that is so awesome. I mean, you guys really you brought some guests today. Tiffany, this has been a show. You were worried about what we're gonna say. There's no worry. There's no worry.
Yes. Before the show, I was talking to Catherine that Shomari was planned to be here this afternoon, and I'm meeting you all for the first time. So, but I believe that Christopher started off the show, and Kristen, and what you have provided so far. I mean, I didn't have to say much at all, and so I'm so thankful to you for being so open, and I know it's a difficult thing for persons to talk about their illnesses at times, and so there are people who would shy away from doing something like this. It takes a bit of bravery, but also that passion that you guys brought to today's interview with Catherine and I, and just being open with us. I'm thankful for that. And on behalf of Health City, Dr. Deepak, and all the members of our team that you mentioned in our international patient care team, or front of house, and so on, we're very happy to hear that feedback. And we hope that you continue 2 years, 3, 4, 5 years, 6 years, 10 years time, you'll continue to maintain your health, be in tip-top shape. And you have a young growing family. You have a beautiful, I saw them earlier. I don't think our viewers saw them, but before, when we were setting up, their children were in the background. I think they were excited to be around mommy. So thank you for sharing that with us, sharing your family with us.
And I think it's very fitting for you to come and share this story, because the impact that it had on you and your life at that time was very, very significant. And I think that this is the direction we need to go in, with what we've all experienced in this year. We've all struggled. We're continuing to struggle, simultaneously. So it's not like one person is better off than the other person. We've all been devastated with this pandemic. So I think for us, for our healing, we're going to have to get closer to how we take care of one another. So just hearing a story like this is so important, as it leads us towards our better health. I'm from the island, and I was here as a little girl. I lived in Boston, so as soon as I heard Mr. Molloy speak, I was going to say Boston, and he said it before I've lived in New York and Boston and Miami in my life, but what I remember every time I was in in Cayman, when I was 5 or when I was 9, I'd always remember how my grandmother would send me down the street with a piece of watermelon to to share with the neighbors, or if she got like some bananas out of her garden or whatever it was always this thing. And then I'd go to the States and live for a few years, and it would be like locked in a door, locked in a house and not safe at all, because you just don't know. So I really had the best of both worlds in a sense. So I know the really good things about America and the really good things about Cayman, and then the things that are challenging. So I believe, for me personally, this is an opportunity for us all to really head in that direction of how do we take care of one another. So you sharing the story is absolutely amazing, and thank you for that. And we're so glad that you're okay and you had this amazing experience. And but yeah, we just want to tell you thank you for that, because we need that. I think that's where we need to be headed. Yeah,
appreciate it. Thank you so much for all that you gave back to our family too. We'll never forget it. So thank you very much.
And Tiffany, we are all in for Health City. Whatever we can do, whenever we can do it. If you have I've said this to Shomari and I'll say it again. If you have people that are on the fence or people unsure about the care, we are volunteering, okay? We are volunteering to help lead a discussion, not for any compensation. That's not what this is about. This is about giving back to the hospital. And as the hospital goes, to some degree, so does the island, right? It's a nice match. A successful hospital is successful for the people, because I believe the hospital probably treats the Canadian people very well, regardless of their financial standings, okay? It's about caring for life, and that's important. We're lucky enough, we have great health insurance, but not everybody is that fortunate, and everybody needs to be cared for, right? For really a successful society. So we're all in. I always send emails to Shomari. I think the last one I said, hey, why don't you have, first of all, you have a beautiful, beautiful hotel on the property, right? That itself could be a resort. My daughter was in that pool. I couldn't get her out of the pool, okay? And the resort it's a resort. So one of the things I said is, why wouldn't you have past patients?
Yes, I'm good. Oh my goodness, you're giving Mr. Christopher Molloy, you're gonna give the marketing team a run for our money because you're doing such an excellent job.
Imagine if you hosted an international, right? Because when COVID goes away, I believe that. And I could be under a misconception. I apologize if I am, but someone had mentioned to me, you were getting a couple of patients a week from the cruise ships. So there's something to be there for a concierge desk. They should have the car service down the street, the rental car place. He should have a place outside the hospital. But I would have a international, let's bring everybody in that Health City, we'll pay our own way, and host a forum, right? Because I think you would have so much, it's not just us. We may be a little bit more willing to talk about it.
Right.
But the work you all have done have impacted many, many families, okay? And we wouldn't all be here today. My son has basketball practice, so he had to go take off. Let's hope he doesn't get COVID, okay? It could be a super spreader event at the school.
Right.
But,
oh, my goodness.
But
you guys keep safe, okay?
If we could do anything, Catherine, on the show, but we are all in with Health. That's how we want to give back. We owe Health City.
Wow.
We owe them a debt.
Oh, we thank you so much for sharing with us. Your passion is unmistaken. We just hope that we thank you. You actually spent almost an entire hour with us on this show, and so that in itself, is testament to the passion that you have. Thank you so much. I hope your son has a good basketball practice this evening. I don't play basketball. Shomari would be like rooting for you so much right now. But thank you so much. We hope that you continue to be safe where you are. I know that, in the Cayman Islands right now, we've been very blessed and fortunate in terms of the pandemic and keeping things under control. But where you are and your family is, please stay safe. Do what you need to do. Follow what Dr. Arteta would tell you in terms of, mask and your hand washing and social distancing, so that hopefully, after our borders are open again and things are a little bit not as hectic and crazy as they are right now in 2020, that you can come back to the Cayman Islands and experience some more Cayman time with us. Um, as much as I want to say, be a patient of Health City again, I actually want you to come back just as a visitor and enjoy the island. Hopefully, you'll have no ailments.
Yeah.
But if you do come on a vacation and you have any kind of difficulties, then you know where to come.
You're in good
We certainly know we're in good hands.
And this will sound crazy to you. Our first stop, we just talked about this the other night. We're at a vacation home, and we're both talking about, boy, we can't wait to get back. The first stop, not 7 Mile Beach, not the Turtle Farm, not Starfish Point. Okay, the first stop is Health City.
Yeah.
Health City.
Oh,
To
wow.
thank
Oh,
everyone.
Okay.
Thank you so much.
Thank
Thank you
you.
for joining
Thank
us
you
this afternoon.
all.
For sure. Take
Happy
care of yourselves.
holidays. Thank you.
What you can, yes, take care of yourselves and have a great holiday season. And you and your family, and everything. Best wishes for the new year. What you can do is you can go ahead and watch the show after on the stream and share it with your friends.
Thank you so much.
Absolutely. Merry Christmas. Happy New Year. Thank you again for your kindness.
Thank you. Take care. Bye.
I may have to.
All right, so there we go. Wow. Now that was a story, and that was awesome. And right from the mouths of babes, as they say, you couldn't get enough. You couldn't get a better advertisement, to put together something. But there's a family that was absolutely affected, impacted in such a positive way. They talked about their life and death experience, mom getting sick on a vacation, and there you guys were, Health City. You're listening to Straight Talk Drive at 5, and this is Medical Mondays, brought to you by Health City Cayman and Tiffany Dixon Ebanks, who is our global sales and marketing manager at Health City. And you were just listening to Kristen and Christopher Molloy from of just patients from a few years ago, just coming in off a cruise ship and being in a crisis and needing to go to get medical care, and got it from Health City, and talked about their 18 days of Kristen being in Health City. And wow, that was amazing.
Yes, that was amazing for to be on this show today. It's a blessing, and I thank you again, Catherine, for hosting us. You asked all the right questions at the right time, and for those listening, whether you're in Cayman or you're listening internationally for future visits to the Cayman Islands, if you want to see anything else about what we have to offer on an annual and daily basis, you can go onto our website at healthcitycaymanislands.com, or you could also email us at info@healthcity.ky. Thank you so much for listening.
Absolutely. And remember the Surgeon's Cut on Netflix. You can check that out. And there is a part there that actually speaks about Dr. Shetty's life. It gets personal, talks about, what motivated him to do what he's doing.
Yes.
And so that's, I can't wait to really check that out, because Health City, I had a really great experience there. And every Monday I sit down with Health City, Shomari, yourself, Dr. Deepak, and many of the others that we bring in on Mondays. So thank you all so much. I have one little motivation quote that I found, and it says, "The healthy, the strong individual is the one who asks for help when he needs it, whether he has an abscess on his knee or in his soul." Ask for help. And what we just experienced was hearing some people talk about help and talk about how that help impacted them. And I love that, because I really believe that we are in a season of needing to be healed in so many ways. And so what has happened to us this year, 2020, right? As the
Yes.
year was starting to get started, boom, And here we are ending this year now. Thankfully, Cayman is in a better spot than almost everywhere,
yes.
right? But we still have to consider our brothers and sisters everywhere.
Yes.
And so, because we're all global citizens. So, as we embark on our new year, finishing off this year and hoping that we get to that better place, you know, one sure way is to just start taking care of each other. Just hold each other, hold each other's hands, walk with each other, and really just take responsibility for each other. So the Molloys really kind of talked about that. And thank you to you guys for what you do every day, Tiffany,
And
for
thank
sure.
and thank you again, Catherine, on behalf of everyone at Health City. Thanks again, and we wish everyone a wonderful Christmas season.
Absolutely. Now, I tell you what, we didn't know the show was going to go this way. We didn't know it was going to go so fast, and we didn't know that it was going to be so awesome, but it was. So there you go. They made your life easy today. Thank you all so much for listening in. This is Medical Mondays, brought to you by Health City Grand Cayman. That was the voice of Tiffany Dixon Ebanks, who's the global sales and marketing manager over at Health City. Hope you guys are well on your way, almost home. If not, you're almost, just enjoying the ride.